How's it going today? My audience will be you guys. Thank you for listening. According to the American Heart Association, 475,000 Americans die from cardiac arrest every year. More than 350,000 of these occur outside of the hospital. 90% of that 350,000 will most likely die. But today I'm going to inform you on something that can possibly double or even triple the person's survival chances of cardiac arrest. Today, I will be informing you about cardiopulmonary resuscitation, also known as CPR. As a former firefighter, I had to learn, relearn, and master the procedure in order to increase the chances of survival of every person I have ever performed CPR on. I have personally taken and taught CPR classes myself. I have also extensively researched this topic to deliver the most accurate and updated information to you. The information I will share with you today can also save someone you love. Cardiac arrest can also happen anywhere, your home, your workplace, or even at a restaurant you're dining in. What I will inform you today can help you adequately perform CPR in the case that someone around you unfortunately experiences a cardiac arrest. The American Heart Association uses the acronym CAB to help remember the steps of CPR. CAB stands for, C as in compressions, A as in airway, and B as in breathing. Most people who hear CPR associate it with compressions due to media, due to movies, and the news. Compressions is when you apply pressure to a person's chest to help blood flow throughout the body. Compressions are just as important to a person's in cardiac arrest because that's what helps restore the blood circulation and provides oxygen to the person's most vital organs, such as their brain. When the heart stops pumping, the lack of oxygen to the brain can cause damage as little as 2 to 4 minutes, according to Alkalskis 2009 journal. Compressions are so important that a person in cardiac arrest that the American Heart Association recommends everyone, whether they're trained professionals or untrained bystanders, to begin chest compressions immediately. To properly perform chest compressions, make sure the unconscious person is in the position correctly, referring to as supine, also knowing as laying on your back. Now it's time to position yourself to perform chest compressions. Take a knee next to the person who's unconscious. Place the heel of your palm, which is right here, on the person's chest, in the center between the breasts, so just about right here where my cotter line is. Once that's there, now keep your elbows straight. Lean over to the person slightly until your shoulders are directly above your hands. Use your upper body weight as you push straight down to the person's chest, going at least 2 inches deep. That's for adults. Roughly 1.5 inches for infants. We're going to be talking about adults today. Continuing to perform compressions at a rate of 100 to 120 compressions per minute. That's usually a ratio of 30 to 2. To keep the correct rhythm and rate compressions, you can sing the song Stay Alive by the Bee Gees or Queen's Another One Bites the Dust. That's personally my favorite. In your head. If you have no previous CPR training, AHA recommends that you continue to perform compressions until EMS arrives, or the person who resigns you, or the person who you're giving CPR to becomes aware that they're back alive. For those who have previous CPR training, the next 2 points I will inform you about are important quality CPR. When the person becomes unconscious, the next step will be giving air. When the person becomes unconscious, normally their tongue falls back into back of their throat. This next procedure is called the head tilt chin lift procedure, commonly known as the head tilt chin lift maneuver. It's as easy as making a C or placing your palm of your hand on the forehead and taking the other hand and pinching the bottom of their chin and lifting it forward. This allows the tongue to maneuver and out of the way of the airway, allowing you to clear their airway. Now, when you open up their mouth, you can see if there's an object. If there's an object, take it out. If you can't get to it, this is where the head tilt chin lift maneuver comes in handy. If you continue to try to remove the item, if there is an item, not only you are wasting precious seconds, but it can also force the item to go even deeper than the person's throat, which can cause a complete blockage of the airway, which is terrible. The force of compressions can help bring the item forward away from their throat, making it easier for you to manually remove the item. Now that I have informed you to properly clear a person's airway, I will inform you on how to properly deliver rescue breaths. With the person's airway closed or cleared and open, you can now deliver rescue breaths. In 2010, the steps for CPR were updated from ABC to CAB by Khalib and Juma, 2010 journal. However, studies show that a person has enough oxygen in their blood to supply their vital organs within the first few minutes of falling unconscious, so the steps were updated to CAB. Prioritizing circulation, which is achieved by giving the compressions that we talked about earlier. Rescue breaths are still important and are performed when a person stops breathing normally. When the person stops breathing, it's normally best to have a CPR mask. Again, head tilt chin lift maneuver, right? And this is what you're going to do. You're essentially going to make a C over the nose and take your E over the back. Head tilt chin lift, making sure you have an adequate seal around the thing, or around the mask. And that's when you will apply your air through this hole. In conclusion to all of this, in closing, many people who suffer cardiac arrest die every year due to a lack of knowledge of basic CPR. Today, I informed you how to properly perform chest compressions, how to properly clear the airway, and how to properly deliver rescue breaths. With all out of hospital cardiac arrests that have happened every year in the United States, 90% will die without immediate CPR administration, according to AHA CPR Facts and Stats in D. However, almost 45% of these victims survive with bystanders administering CPR. With the information I discussed with you today, you can make an impact and increase these numbers. Thank you for listening, and I hope I taught you something.